Good morning everyone. Our group will be presenting how to take care of your pet. So I will be start off with the first and the most important parts is what you need to know and prepare and understand before you bring a cat or a dog into your life. We often fall in love with the ideas of owning a pet, and today I will help you to decide whether you are truly ready to become a pet parents. Before that, I would like you to ask yourself, why do you want to have pets? Is it because they are cute, they make you feel secure and less alone, or maybe you enjoy the daily joy and laughter from their playful antics? And do you want someone to comfort you when you are sad? So those are the beautiful reasons, but here's the reality check. Not all pets are cute and cuddly. Some can be little home destroyer, destroying your furniture, scratching around, or making messes. Some may even not listen to your commands, no matter how hard you try. And just like humans, they fall sick, and what comes along is the expensive veterinary bills, medicine, and often with emergency cares. So before you welcoming a furry friends into your life, ask yourself, are you ready for that? Getting a pet isn't just a hobby, it's a long-term commitment that lasts for 10 to 20 years. You need to understand your responsibility in terms of feeding, healthcare, grooming, exercise, and also bonding with them. And also be prepared for an adjustment period for 1 to 2 weeks time. They may feel confused, anxious, and overwhelmed as they need to acclimate to a new surrounding and routine. And also, are you ready to adjust your lifestyle to fit their daily needs? Like, are you ready to take out some of your time to make a bond with them? If you are ready, then we'll move on to the next section, which is the financial preparation. People always say that having a pet is not cheap, as there will be a few parts of financial that you need to prepare. So firstly, it will be the initial investment. Whether to adopt a pet from a shelter or buying from a breeder, it will need to cost you the main part of the budget. So if you adopt from the shelter, it will cost you from tens to 100, or if you want to buy from a breeder, it will cost up to 1,000. And also buying cage, bowl, beddings, leash, litter box are those setup costs that you need to prepare before having the pets. And also there will be routine expenses on medical for regular checkup, vaccination, deworm, and ticks or flea prevention, and sometimes for emergency. And you might also think of buying pets insurance. And there are also ongoing costs for their food, treats, supplements, accessory, toys, and enrichment, or even grooming supplies. So owning a pet is a financial responsibility. Make sure that you prepare before you committing. Next is to prepare your home environment. Make sure your house is safe and pet-friendly house. You will need to keep all those dangerous stuff or even sharp items away, and it won't be reached out by the pets. You also need to set up an initial pets item such as bedding, food area, play zone, or litter box or pee area. And also be aware that there's toxic plants like lily, aloe vera, or sago palm, which can be fatal if ingested by cats and dogs. So once you have done preparation, you might start to think of whether to have cats or a dog. So how do you decide yourself? So you might have to consider from these 3 points. Cats are generally more independent and low maintenance, and great for a smaller home or apartments, and they are quiet companions. They groom themselves and don't need daily walk, so it will be low activity needed and low maintenance. Whereas for dogs, they are loyal, they are affectionate and active. They are social animals and need outdoor spaces, regular exercise, and more of your time and attention. So ask yourself, do you prefer a more quiet companion or exercise buddy? Of course, after you have picked either cats or dog, don't skip the research part. You might have to think of what breeds, or you might need to think of different breeds have different needs in terms of grooming, activity level, and temperament. Consider of age too. Puppies and kittens are adorable, but they need constant attention. Older pets are calmer, but they have health issues. You also need to learn about their diets and nutrition, training, and behavior. Set up your home schedule based on pet specific needs and know where nearest vet is located. Last but not least, you can follow the 5 freedom from animal welfare as a guideline for active parent ownership. Freedom from hunger and thirst, freedom from discomfort, freedom from pain, injuries, or disease, freedom to express normal behavior, and freedom from fears and distress. These are the basic rights for every pet deserve. If you can't provide all of this, it may not be the right time for you to get a pet. To wrap this out, getting a pet is a beautiful journey, but it's also a serious responsibility. If you thought it through, you are ready. Congratulations, you are on your way and giving a cat or a dog a loving forever home. Thank you.
So hi everyone, my name is Jenny and I would like to present on the next subtopic, which is your pet trying to tell you something and to understand their behavior and any health needs. So we always come up with a lot of questions on, is my pet angry at me? Is my cat judging me? Does my pet love me? Or why the cat hits me? So first of all, why is this important? Why we need to understand our pets and how they behave? First is to build stronger bonds between you and your pet, because you guys live together and your pets can't speak, so you need to understand their body language because you need to understand their gestures. So the next one is to improve their well-being. You need to create a supportive environment of your pets. So because cats and dogs both behave differently and their natural behaviors are different from human. So you need to understand their body language and try to let them suit into their environment. Last of all is to foster a safer interaction between you and your cat, especially dogs, because dogs are social animals and sometimes they can be aggressive. So you need to train them and you need to treat them with care to provide and address behavioral problems. So catitude. When it comes to cats, you will know that cats are usually subtle and independent. And these are some few key features of body language that you can observe from cats, like eyes, ears, body postures, and tails, movement. However, you need to remember that context always comes first. So, what is the context? Actually, context includes physical cues, surroundings, and body directions. Normally, cats, when they are trying to do something, they will direct their body into a direction in which it will forecast their intentions. And maybe when they are looking at you, it means they are responding to you. Another one is physical cues, like just now that I mentioned. Ears, eyes, tail movement, and the body postures, and all of the integration of it will indicate maybe happiness, curiosity, fear, or aggressions in your pet, as well as surroundings. When your pets are in a dark and confined space, it will become more stressed and it will display abnormal, non-natural behaviors, unlike when it's in a relaxing, open, and high perches. So simple interpretations of catitude. So I would like to show this example to show you the difference in context. Okay, same thing, tail lifted vertically. When the cat is at home looking at you and the tail is lifted vertically and reach you. So it may indicate that this cat is confident, comfortable with you being around and open to your existence. However, when the tail is lifted vertically when meeting other cats which hits its own territory, the cat might be preparing to attack and is potentially aggressive from all the movements, as well as you need to integrate other key body language. So, fun fact, the Venus pet trap. So we usually come up with owners that say, why my cat attacked me? But the body posture is like very relaxed, laying down there, exposing its belly, like showing trust and security. Yes, exposing belly does show that the cat is expressing its trust towards you, but it's not always means that you should go with a belly rub. Because in other contexts, this cat is actually ready to fight off and aggressive with its claws. So be aware of that. Because cats are subtle and cautious animal, we need to understand. I would like to guide you guys through like small changes in their body language. So I will come with tail first. So usually when the tail of cats is high, friendly or vibrating, it may show excitement, comfortable or happy. But in other contexts, it may be vibrating because it just want to spray some urine for markings. However, when the cat running towards you with these gestures, it usually means that it is comfortable with you around. When the tail is lower down or tucked, it may indicate that it's anxious, uneasy or guilty. Judging by the looks of this cat, you can see that it got other key features around that shows that this cat is a bit stressed out. So we always come up with a question that why my cat's always flicking when I'm petting the cat. Yes, actually it is on high alert mood when it's flicking its tail. It may indicate upset, lack of receptivity towards your touch. Maybe it's getting bored of your petting, or it's agitation. Maybe it's the time for you to back off from petting this pet. So, and the eyes. So actually, the cat's eyes, like human eyes, is a window upon a lot of emotions. So when it's dilated and large, it may indicate fear, excitement, or anger. So it's like very different. So you need to integrate with other key body features to understand, and the context as well, to understand what's going on. And another thing is very interesting about cats is when they are slowly blinking, usually we will see the article, some news saying that cat slowly blinking is showing love towards its owners. Yes, it may indicate trust and is comfortable, or is trying to make itself comfortable. So when a cat's eye is narrow and constricted, it usually relates to aggression and upset. But in eyes, the dilated or narrow eyes may be due to the surrounding light changes and other external issues. So beware of the context. For ears, when the cat's ears is forward, it may indicate confident, calm, and engaged. So when you are trying to play with your pet, when you throw a ball, when the cat look at the ball's direction, the ears will be forward because the cat is engaged in that activity. When the cat have high or erected ears, it may indicate alertness and playful. Yes, this also expressed when it's playing with you. When the ears are turning back, it may indicate angry or fearful behavior. So we will see it a lot in vet clinics where the vet's trying to touch your animal. It may show signs of this because cats are scared of doctors too. So last but not least for cats, vocalizations. So usually wondering why the cat is yowling like whoa, 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 whoa. So actually what I saw is the cat is usually out of options. It's like don't know how to communicate with you, or it's demanding something, or even it's in heat. So it's also to have a lot of different contexts of that. So why the cat growl or hiss usually is to tell you to back off and felt threatened. Otherwise, purring or trill may indicate a very friendly or greeting gesture. However, you should know that purring It's also a sign that the cat is making itself comfortable, trying to make a stress conditions, trying to behave in a stress condition. So it could be indicating pain too. Otherwise, meowish could mean almost anything, from hunger to simple chatting with you. So this is also like based on a lot of context. Like other general posture expressions, like relax. Usually, when a cat is relaxed, it will expose its body parts and facing you, meaning that it's letting their guard down, showing interest in you, and willing to be touched by you. However, when the cat shows aggression, usually their hair will stand, making them looking bigger, and they're turning sideways to the threat, which is you. Usually, this means that they are ready to fight or ready to escape, because turning sideward easy for them to run faster. For dogs, actually, what is most different thing of dogs and cats is that dogs are very expressive and social animals, but their key body features such as eyes, ears, mouth, and tails are subject to different contexts as well. So for dog, I will be presenting in a more general picture, because different from cats, dogs are more expressive. So what we will see in a relaxed dog is that the dog will have soft eyes, forehead with no wrinkles. It looks at you really relaxed. And the mouth usually open or closed without tension, relaxed and painting when running towards you. The ears are high and forward, listening to your instructions. And the tail are usually loosely wagged, held even with its spine. So it's like the same level from the spine. So when the dog is alert, like canine dogs, it should have wide eyes, meaning that it's very alert and succumb to a lot of instructions. And the tail should be extended from the body, is in the tense movement. The mouth should be closed and the ears will point forward towards the stimulus. In a stressed dog, usually a stressed dog will avoid any eye contact because it's fear from you. And it usually helps a crouching position and lip licking to assure itself, to make itself more comfortable around you. And the tail will help lower, making it becoming smaller than wanting you to let it go. For aggressive dog, usually dogs will expose their teeth and raise their upper lip. The tail will be low or high above body. It depends on different contexts. The eyes will fix on the threat and will give a hard stare, and the ears will go forward or to the side. So, last of all, I would like to share with you that dog and cat's behavior are much more different. In relaxed position, dogs will wag their tail. Otherwise, cat usually won't wag their tails. And trusting, both are same. They will expose their body parts towards you because they are animals. Their sign of showing trust is to show you their body parts. So for a nervous dog, usually they will avoid eye contact, tail will be low. For cats, the ears will be at the side. For scared animals, dogs will be trembling, and both dog and cat will tuck their tails under their body. So an angry dog will growl and bare their teeth, while for cats, the ears will be back, hissing, the body will be looking much more flattened, and it will growl as well. So, thank you everyone.
Okay, so moving on. Hi everyone, so my name is Crystal. So I would like to ask everyone a question. So have you ever looked at your cat and sleeping 20 hours a day and ever wondered, are you lazy or just like secretly planning something? Have you seen your dog like staring blankly at the bowl or football and thinking, what's going on, friend? So I would like everyone to remind everyone that pets don't say and cannot say that I don't feel good. And they are masters of disguise. And the dog may always wag its tails while it's sick, while it's angry, while it's happy. And the cat might also nap for hours like usual, but something might be wrong with them. So how do you tell the difference between a lazy cat or a lazy dog and a real health issue? And that is what this session is about today. So I'm going to share with you the signs of illness every pet owner should know, and how we can keep our furry friends feeling their best. So let's talk about some red flags. There are common signs of sickness in cats and dogs I've listed here, and this part of it. And we can see that there are some vomiting,
there's some diarrhea, change urination or defecation habits. For example, maybe they are usually going to the toilet for defecating, but this time they may be defecating everywhere, and they may have decreased appetite or excessive scratching, licking or biting on their body or on their paw, or they have been very tired or sneezing frequently. And these are this part of it, and there are many more. And these are also signs that you need to bring your pet to the vet. So moving on to parasites. So I'd like everyone to categorize these parasites into two major ones. First is the endoparasites, and another one is ectoparasites. So what is endoparasites? It's the tiny creatures that live within your pet's body, such as in the heart or in the intestines. So the common examples are like heartworm, roundworm, and also tapeworms. So for ectoparasites, these creatures that live on your pet's external body, such as the fur, the skin, and also the ear. The common examples are fleas, ticks, and mites. So these parasites are like having buffet on your pets. So how do you know if your pets have parasites? There are also signs to notice on them, such as diarrhea. They maybe have bloody diarrhea or just plain diarrhea, or they have weight loss that is unusual, that you see is very fast, the weight is dropping very fast in a few days or few weeks. You can see them scooting like this picture, they're like having a break dance, but it's not something cute. And you can see that visible ectoparasites on their body, for example the ticks and also the fleas. And you also can have seen them excessively scratching or licking or biting on their body until they may have some bleeding or redness on their skin. You can see them coughing, or you can also see some worms in the stools, especially in the puppies. And these are also this part of it. There are also many more for us to take note of it and to bring it to the vet as soon as possible to cure these things. So as for human, animals also get infections. So the major infections are three, like bacterial, viral, and fungal. So first talking about the bacterial, I listed some examples like leptospirosis, which is also have in human from the rat urine, and there's salmonellosis and also campylobacter. So viral I've differentiated into cats and dogs. For the dogs, we can always see like canine parvovirus, which is very common in puppy, which have bloody diarrhea. We also have canine extemper virus and rabies, which is very popular. We also have virus in cats, such as feline calicivirus, feline hair leukopenia, and also feline herpes virus 1. And for the fungus, we can always see ringworm, like the one we always get on our skin as well. It's a circular shape on our body, and on the pets there will be also circular and also some loss of fur. We also have malassezia and also aspergillosis. So how do you notice or how do you know if your pets have all these infections? As similar to the front, but there are a bit different signs, which are skin infections, there may be redness, there may be swelling or loss of fur. They may have oily coat without them playing with oil. They have distinct odor. It's not something because of the food or because of them playing dirty. Or they have itchiness, keep scratching on their body. Or they may have oozing patches or reddening of the skin, and also have thickened skin. Same because of time constriction. This is part of the signs of the infections. There are so many more for us to look out and also notice them, and these are signs that we should bring them to the vet. So as same like human, furry friends also have allergies. They may have allergies to the food, to the environment, to the contact irritants, or to the flea or skin. So for the signs of pet having allergies, there are signs of vomiting, diarrhea, itchiness, sneezing, or having watery eyes, also having excessive hair loss, and also skin lesions. And these are signs of many skin allergies or any allergies that could be sourced from many different sources. So now I'll be talking about routine vet procedures for pet health. So we always know that prevention is always cheaper than cure. So these are the routine vet procedures for pet health that we can do. First is vaccination. So you might be asking, when should I bring my pet to vaccinate, especially in the puppy or kitten? So actually we can bring our pet, our kitten or puppy as early as 6 weeks old, but everything will be consulted by the vet prior to the vaccination. And next, you will be asking, then how long is the vaccination interval? I may not be free for every week to bring for the vaccination. So actually, primary vaccines usually require 3 to 4 weeks interval for the next vaccine, and the booster vaccines after the complete vaccination will usually require 6 months to 1 year interval. And for the side effects, just like human, our pets also have side effects after vaccination, and these side effects are different depending on the human. So first is like discomfort on the vaccination side, or they may be swelling, they don't want you to touch it, and they might grow or hiss you when you touch them, or they may have decreased activity, they look tired, they keep hiding on their spot, or they may have mild fever. And anything that you feel suspicious or you feel that is quite severe, you should always refer to your vet as soon as possible. So, and some people might be asking, can I vaccinate my pet at home by myself or anyone other than the vet? This is definitely a big no, because vaccinations can only be done by certified veterinarian. So please don't trust any home vets that say, oh, I can vaccinate for you, it's a cheaper price. Okay, next moving on to parasite control and prevention. Like I have said before that, there are 2 types of parasite, which is ecto and endoparasite. So there are also types of parasite control and prevention that we can do, such as deworming, which is targeting the endoparasites. We also have ectoparasite prevention, and also the combination treatment that combines both endo and endoparasites. And the administration routes are also including oral, where you can feed them, or it's a pill, or you can have topical, which spraying on their body, or you can have spot on, which put on the back of the neck. We also have injectables that is done by the vet. And all these routes are depending on the products. So on the importance of this parasite control and prevention is definitely important for them, because this can prevent irritating infestation in them, and to prevent serious disease that is brought by the parasites. And these parasites are always everywhere around us, so it's important to control and prevent them. And also to prevent zoonotic diseases, as some parasites can be transmitted from the animals to us. So next is dental care. So why is dental care important? Not only we humans need dental care, our pets also need dental care, like brushing teeth or at the vet clinic. All these are important for prevention of dental diseases like tooth decay or tartar build-up, and to prevent systemic diseases, and these bacteria or infections can come in through your teeth or the blood vessels, and also to improve the quality of life so that they can chew and eat their food properly and not having pain while they are chewing. So there are examples of dental care procedures are like oral examination, dental scaling like the picture above, and also have dental charting where the vet will write down and jot down each teeth, any problems on it, and also have tooth extractions if they need, especially when they are old or having some issues on the teeth. And lastly is about annual checkups. Annual checkups is very important, like how we humans go to the clinic for every yearly checkup. It's to early detection of diseases, and this includes like vaccination and parasites control and prevention, and so to monitor age-related changes, as our pets grows old quite fast. It's like faster than us humans, so it's important to know like anything changes in their body, so we can prevent and also know what's the next step with them. And so dental health assessment, as I spoke before. So the common health checkups that we can done in the vet clinics are like physical examination, blood tests to monitor their liver or any organ parameters, also dental evaluation, weight and body condition score evaluation, health record update, and planning for what is the next step that we can take. Okay, so I'll talk about something about neuter. So you might be hearing this neuter word quite often. You might be hearing it like, have you neutered a cat, have you neutered a dog, and you might thinking, then what is neuter? So neuter is removing an animal's reproductive organ to prevent them from reproducing. And we have two big terms here, which is castration. This term is for male. This is to remove the testicles from the male cat or dog. And another one is spay. This term is for female. This is to remove the ovaries and uterus from them. Then you might think, why neuter them? Is it not very pity for them to have not breeding? Then actually neuter have a lot of benefits for them. So for first one is health benefits. It can really prevent a lot of uterine infections and testicular cancers in them. And next, we have behavioral benefits, especially in the male animals. And it can reduce aggression and also reduce the marking and roaming of them. And also prevent fights when they want to breed. And also to prevent unplanned pregnancies and prevent pet overpopulation. As you can see, there's a lot of strays out there already. So neuter is already a very good and effective way to prevent them, to quit overpopulation. And also last one is to have longer lifespan in them. So I think that's all from me. I will be passing on to my next friend. So thank you, Crystal. So I'm Shui and I will continue on with my part. So imagine this. You walk into a pet store or you're just scrolling through your normal browsing through your Shopee or Lazada. You will see that there's aisles of different types of kibbles, canned food, raw pet food diet, grain-free diet, fancy ingredient lists from turkey, crocodile meat, kangaroo meat. What are those even? So you'll be thinking, is salmon better than chicken? Should I go grain-free? What is even gastrointestinal diet? Do not worry, you're not alone. Feeding our pet has become more complicated than ever, but I'm here to cut through the noise. Because what do you put in your pet bowls isn't just their food, it's their medicine, what fuels their daily life, and a big part of their health as well as their happiness. So buckle up, I will bring you to the world of pet nutrition. And I'll be mainly explaining on the different types of feed, types of therapeutic diet, what to not feed, and food allergies and intolerance for your furry family members. So, starting off for the $1 million question, what should you actually feed your pets? So there are three main diets for your pets, which is the commercial diet, raw diet, as well as the home cooked diet. So first of all is the commercial diet, which mainly include the kibbles and canned food. So for the advantages of commercial diet, it is that it is convenient and time-saving, nutritionally balanced when labeled complete and balanced, scientifically formulated by vet nutritionists, it has a long shelf life as well as it is cost-effective. As for the disadvantages, it may contain fillers or additive in lower quality brands. Some pets may be picky, and it is not tailored to all of the individual pet's needs unless it's a prescription diet. The next one would be the raw food diet. For the advantages, it mimics a more natural ancestral diet. It often has high in protein and moisture. It may improve coat condition or dental health if bones are fed safely, and there is no preservative or artificial ingredients if it is homemade. As for the disadvantages, there will be a risk of bacterial contamination such as Salmonella or Listeria. It can be nutritionally unbalanced if not properly formulated. It is unsafe if bone may cause choking or injuries. It may be more expensive and time consuming. As well, it is not suitable for immunocompromised pets or humans. So for the last one, which is the home cooked diet, for the advantages, it is customizable for pets with allergies or medical needs. It is made with fresh, whole ingredients, and it strengthens bonds between pet and owners. As for the disadvantages, it is time-consuming to prepare. It is easy to miss key nutrients without vet guidance. It requires regular monitoring and adjustment, and it might be costly depending on ingredients. So sometimes food does more than just nourish, it heals. For pets with conditions such as kidney disease, diabetes, or allergies, special diets can be a huge part of their treatment. So let's take a look at how tailored nutrition can help to manage all of these issues. So it includes mainly of renal diet, obesity diet, thyroid diet, diabetic care diet, hydrolyzed diet, urinary diet, dental care diet, gastrointestinal diet, recovery diet, and joint diet. So I'll only be picking a few of the therapeutic diets to explain. So for the first one will be the renal diet. It is mainly for pets with kidney diseases. So renal diet contains of low phosphorus, which helps slows the kidney damage, moderate proteins, which reduces kidney workload, low sodium, which protects cardiovascular health, omega-3 fatty acids, which acts as an anti-inflammatory, high calorie and palatable, which encourage patients for eating, rich in B vitamins, which replaces losses of urine. So the next one would be the obesity diet. It is mainly for weight management issue. So it has high fiber, which promotes satiety, low calorie density with fewer calories per gram, balanced nutrient profile, which prevents deficiencies, and may include L-carnitine, which helps burn fat. And for hydrolyzed diet, it is mainly for pets with food allergies. So it has proteins broken down into amino acids and peptides. It's too small to trigger immune response, which helps to benefit them for their allergy problems. And it's used for diagnosis and long-term management of allergies. For the number 6 one, it will be urinary diet. It is mainly for pets with bladder stones and crystals. It helps dissolve some of the stones such as struvite, adjusts urine pH and limits stones forming minerals. It encourages water intake and it may be a lifelong diet to prevent recurrence. The next one would be the dental diet. It is mainly for dental problems. It has large fibrous kibbles which promotes chewing and plaque removal. It slows down tartar and calculus formation, and it also helps support overall and oral health in dogs and cats. For the next one will be the gastrointestinal diet. It is mainly for weak GIT pets. So it has highly digestible diet which is gentle on the GIT tract. It is moderate to low fat for pancreatitis issue, and it often includes omega-3s and prebiotics. So as they say, sharing is caring. I do believe that we all love to share with our pets, whether it's just a snack from our table or a bit of comfort when they are feeling unwell. But do you know that some everyday foods and common medication can be incredibly dangerous and fatal to them? So let's go through some of the biggest hidden dangers in our kitchen and medication cabinets. So the first one of all, we all know chocolates. Who doesn't like chocolate, right? So why pets cannot contain chocolates? It is because chocolate have theobromine and caffeine, which can cause vomiting, tremors, seizures, and heart issues in pets. The next one will be grapes and raisins. It can lead to sudden kidney failure in dogs. Toxic dose varies, even small amounts can be dangerous to them. The next one will be onions, garlic, and chives. It causes destruction of red blood cells, which causes anemia. Both raw and cooked forms are harmful to them. The next one will be xylitol. In sugar-free gum, candy, and toothpaste, it triggers rapid insulin release and leads to hypoglycemia and could cause liver failure in dogs. The next one will be raw grape low, which contains yeast. It will cause the expansion of our pet's stomach, which will lead to bloat, gas, or alcohol toxicity. The next one will be the alcohol. Even tiny amounts can depress their nervous system, and it will cause vomiting, tremors, coma, and even death. And for fatty foods, bacon and fried foods, it can be tempting to give our furry pets, but it can cause pancreatitis to them and leads to vomiting, pain, and potentially hospitalization. The next one will be Panadol, in the form of paracetamol and acetaminophen. It is extremely toxic to cats, harmful to dogs in high doses. It causes liver damage, oxygen transport issue, as well as death. The next one will be dairy products. In many pets which are lactose intolerant, such as milk, cheese, and ice cream, can cause diarrhea, gas, and bloating. It is not acutely toxic but causes digestive upset. The last one would be macadamia nuts. It causes weakness, tremor, vomiting, fever. Even small amounts can make our dogs really sick. So do you sometimes notice that your pet is constantly scratching or getting a tummy upset? Food allergies and intolerance are more common than you think, and the signs often show up on their skin or in their stomachs. So let's look at how to spot them and what you can do. So for the common symptoms find, it is itchy skin, especially at areas of their ears, paws, and face. You'll see that they'll have red or inflamed skin, recurrent ear infection, vomiting or diarrhea, flatulence or soft stool, as well as excessive licking or scratching or just rolling around the floor. As for the common triggers, it is commonly due to beef, chicken, dairy, wheat, soy, or egg. And most allergies are due to proteins and not grains. And how do we diagnose it? So we can perform elimination diet trial by our help of our vet professionals. It is a due of 8 to 12 weeks on a hydrolyzed or lower protein diet, which I just mentioned just now, and it gradually reintroduces all foods to find the culprit. As for the dietary adjustment, can switch to hydrolyzed protein diet or lower protein such as duck or kangaroo meat, and always to remember to avoid table scraps or treats during the food trials, as well as to work with our veterinarian for a proper plan.
huge way. Good morning everyone, my name is Jay, and today I'll be talking about how to take care of your sick pets. So pets are part of our family, and when they fall sick, they depend completely on us to recover. So, and then unlike human, pets tend to hide their pain and they will not eat the medication on their own. So it's all up to us as the responsible owner to know why it's important to take care of the sick pet. So I'll be talking about three main points here, which are the post-surgery care, giving medication, love and attention. So firstly, post-surgery care. So it's important to set up a quiet recovery area. You may provide a strict cage dress to prevent any excessive movement. If you have any children or other pets at home, it is important to keep them away from your sick pets and also away from stairs to prevent any jumping up and down. Next is check the surgical wound daily. It is normal to see signs such as mild redness of the wound or minimal swelling. It is just part of the healing process and it will reduce by time. However, if you see signs such as discharge, bleeding, open incisions or even severe swelling, you should immediately consult your vet. And next is pain management. Usually after surgery or any vet visit, your vet may prescribe you some medication to give your pets, and you should follow your vet's prescription and never skip doses. Next is prevent licking and biting of the surgical wound, because animals tend to bite their wounds due to itchiness. And you may put on e-collar, which we also call it Elizabethan collar or surgical suit, to prevent any disturbance. Because licking or biting will cause opening of the wound, inflammation or suture breakdown, and this can delay recovery. Next is the recovery times, which it varies by surgery. For minor surgery such as neuter, it will take around 10 to 14 days. For major surgery like bone surgery, it will take a longer time, which is 6 to 8 weeks. And it is important to follow up with your vet after the surgery. Your pet may require a suture remover. For example, bone surgery, your pet may require an implant remover. So, what is the importance of the post-surgery care? It is to prevent complications, because poor caring can lead to infections, delayed healing or even emergency, and this will require you to bring your pets to the vet, and this will cost you some money, which we want to avoid unnecessary expenses. And lastly is to improve your pet comfort. Now, let's talk about how to give medication. There are three forms of medication that are usually given, which are oral, which can be pill or liquid, ears or eye drop, which can be ear cleanser or medication like ears drop and eye drop. Lastly is the topical, which can be cream or ointment. Now let's look at the video here on how to give the pill. So what you have to do is to hold the head, and then with another hand open the mouth, drop the pill in, and then just push it in gently. For the liquid form, you may have to prepare a syringe with the medication, then just slide it from the side and then slowly push it in. For oral medication, it can be tricky, so here are some tips for you. For dog, you can hide the pill in canned wet food or in the treats, because dog will usually just eat up everything unless they are not in a good appetite. For cats, you can wrap in a towel, because when they are stressed or uncomfortable, they can scratch you. So you can trim their nails first before giving to prevent them from scratching you. And you may also give pill use pill popper for tablet or capsules. For eyes and drop medication, so for ears, you just have to lift up the ear and then drop the eardrops following your vet's prescription, and then just slowly massage. Yeah. And for eye drops, you will have to hold the mouth, then with another hand just drop
lift up the eyelid and then drop it directly on the eye. And lastly is topical medication. For creams and ointments, you can just apply a thin layer directly on the wound by using cotton bud, and you should avoid touching the wound to prevent any contamination by wearing gloves. For ticks and bee prevention, which we also call it parasitic prevention, it is usually topical, and you just have to put oil at the back of the neck. So look at the photo here. What you have to do is just part the fur between the shoulder blades until the skin is visible. Then just apply the full contents of the tube directly to the skin. But be careful because this parasitic drug can be toxic. So it is important to avoid contact to your skin and wash your hands afterwards. Now, let's not forget one of the most powerful healing tools, which is your nerve and attention. Your sick pets can feel scared or depressed when they are in pain. So it's important to be present by their side by just spending with them, talk to them, or just sitting next to them. And next is gentle physical contact such as petting, which not only help reduce their stress and also yours too. Lastly, next is comfort in sleep, which you can provide soft bedding, warm blankets, or even their favorite toys, and also avoid loud noises because this will stress them out. Lastly is positive reinforcement, which you can praise and reward them with some treats after any treatment, such as giving medication. So in conclusion, caring for sick pets is not just about giving medication, it's also about being there for them. Your love and attention are just as important as any medication, and with your care, they will feel less scared and recover faster. So thank you for listening. I hope this helps you care for your pets even better. Thank you.
Thank you, Jay. So I'm Jocelyn. Today I will take you through the wonderful world of pets. And this will start from their first tiny meows and tail wags until their golden senior years. Let's get into how to care for them at different stages of life. The little pups and kittens are aged from 0 to 7 weeks old, while for senior pets, they are aged 10 years old for cats, while 8 years old, more than 8 years old for dogs. Puppies and kittens, they actually develop immature immune and digestive system, and they are growing incredibly fast. So we will need to give them very intensive care to prevent any accidents or diseases that will develop among them. So we will need to check for defects such as a cleft palate when they are born, in which this will lead to difficulty in eating, nursing, and poor growth. Here I have attached an anatomical picture of the brachycephalic breed, where we can see there's the hard palate and soft palate behind their mouth, in which the cleft palate might develop. Behavioral-wise, we divide it into 3 stages. There are neonate, which is from 0 to 2 weeks old, while transitional stage from 3 to 4 weeks old, and socializing stage from 5 to 7 weeks old. Neonates are extremely lazy, we can say that, as they sleep for 90% of their day. And they will need to be stimulated for defecation and urination by their own mom, or if they are often, they might need to be stimulated by us or pet owners every 2 hours. This is a correct demonstration of how to stimulate a puppy to defecate and urinate. Just gently tap on the anal region or right below the anal region. Their body temperature should also be maintained around 35 to 37 degrees Celsius via their own mother or fetal pad or warm water in the glove. This is how it should look like. While moving on to the transitional stage of the neonates, it is a very critical time for socialization to begin, and the socialization window will close around 12 to 14 weeks. And at this time, they will learn to be disciplined and social skills, how to play, and even how to stop biting. I've noted down some of the significant events of a puppy or a kittens that every pet owners should know so that you can monitor their growth. The first one will be the umbilicals should dry up and fall off during day 3. While day 5 to day 6, they will be able to support themselves on their front leg. Day 10 to day 14, their eyes and ear canal will be fully open, which means they can receive stimulus from the environment. While for day 18 to day 21, they will attempt to walk and they can concentrate their own urine. For day 21, we should allow attempts of socialization with the environment, with you, pet owners, or even with their siblings. Feeding wise, neonate is important to get colostrum from their mother, which is between 24 hours after their birth. They should be fed 8 to 10 times per day by their own mother or by us if it is often with milk replacer water feed every 3 to 4 hours. During transitional stage, they will go to their mother and feed by themselves for 4 times a day, while for often we will need to bottle feed them for 4 times a day. This is the correct demonstration of how we should bottle feed a kitten or puppy with right side up, meaning they will be laying on their bellies. Moving on to the socializing stage, they should consume 3 times the amount of calories required to meet their resting energy requirement. Now let's move on to the golden age of pets. Cats, just like what I have said just now, they consider as senior when they reach 10 years old, while dogs they consider as senior when they reach 8 years old. What do senior pets really need in order to stay happy and healthy for as long as possible? For dog and kids, both of them, they require increased veterinary care. They should visit a vet 2 times per year. One of the most important things we can do is increase veterinary visits, as these exams are more in-depth and may include dental checks, blood tests, and screening for age-related diseases, as what Crystal has said just now in a previous presentation, as early detection can make a big difference. Diet and nutrition is another key as well, as what Shuwei has already presented just now. This is always a $1 million question. Older pets may need food that's easier to digest and has the right balance of nutrients for their age. Some may benefit from special diets and anti-aging ingredients or joint supplement. Weight management also becomes very important. Senior dogs often gain weight, which can strain their joints and muscles. On the other hand, senior cats are more likely to lose weight, which can be a sign of illness, and keeping them healthy is very important for their longevity. Aging can cause stiffness, arthritis, and they can experience very painful diseases, but regular low-impact exercise like gentle walks or swimming can help maintain mobility. Supplements and physical therapy may also help. Just like people, senior pets can experience cognitive decline. Signs might include confusion or changes in behavior. Regular interaction, playtime, puzzle toys can help them to keep their mind active and sharp. As they age, pets need changes in their environment. Consider providing soft bedding, easily accessed food and water bowls, and avoiding stairs or slippery falls to help them prevent injuries and stress. These are some of the common ailments in senior dog. which are dementia, arthritis, cancer, diabetes, kidney diseases, and blindness. For arthritis, the clinical signs will be like limping, reluctant to move, aversion to stairs, difficulty standing or walking, and exhibit pain when picked up. While for cancers, we can observe any significant lumps or bumps on his body, changes in weight, sores that heal slowly, bleeding from the mouth or nose or ears. For diabetes, it is very common to happen in dogs aged from 8 to 9 years old, as their clinical signs would be frequent thirst and increased urination, weight loss, fatigue, irritability, recurring infections, and low healing cuts or bruises. Or for kidney disease, they will show loss of appetite, weight loss, vomiting, and brown discoloring on the tongue, and may develop an ammonia smell to their breath. These are some of the clinical signs that you can detect as early detection. Blindness, cataract is actually a normal aging process of dogs in which there will be increase in opacity of the pupil. Dementia is the forgetting disease where humans will also normally get when they are old, in which they will start to forget their familiar toys, their housebreaking techniques, and even their homes. Or for ailments in cats, senior cats, it is also similar with dogs, but in addition of another 4 new ailments such as heart disease, hypothyroidism, hearing and vision loss, and gastrointestinal disease. For heart disease, for cats it is most common to get hypertrophic cardiomyopathy, which leads to fade, where I note down here that fade is a blood clot that can be lodged where the aorta branches near the cat's hind leg, and they will develop sudden pain, hind leg paralysis, and vocalizing. For hypothyroidism, we can see that the cat will experience weight loss despite to healthy and sometimes ravenous appetite. For hearing and vision loss, they are actually secondary to many of other conditions. Vision loss mostly is secondary to high blood pressure or injury, while hearing loss is secondary to conditions like polyps or chronic ear infections or tumors. For gastrointestinal disease, it is manifest as vomiting, diarrhea, lethargy, and loss of appetite. And I think that's all from my part, and I would like to represent our group to say a very to say thank you for all the listeners.